Good afternoon and welcome to our 10th Spine Center webinar. My name is Michael Graham with Priority Consult. Look forward to speaking with you today. Very excited because I'm joined by Ali Willis. Ali is the Physician Liaison and Marketing Specialist with the Mayfield Clinic and Spine Institute here in Cincinnati, Ohio. You know, real quick, before we ever decided to start doing these webinar series, we weren't quite sure what the participation would be and what the interest level would be. But we've been very excited about the number of registrants that not only show up today for the first time, but many of you coming back for the second, third, or even fourth time. We're going to be doing something a little bit different next month. I want to make sure that you're all aware of this. We're putting together a one-day workshop based in Chicago, and we're going to be bringing in 5 different speakers, users of the system. Some of the names you'll probably recognize as previous presenters on other webinars that we've done. And if you are interested, please contact us in the next couple of weeks or so to get registered. It's only going to be $250 if you reference the webinar itself. And we're going to get as many folks as we can to start talking about sharing best practices and building the best possible program. Along those lines, we are really happy to have Ali join us today, because when you look at some of the opportunities to improve your program, there's really one important factor which is most critical. And it's not outcomes, it's not physician alignment, those things are important, but when it's all said and done, people are judged and their success is judged on how many patients are you actually getting to come through the door. And folks like Ali are out there and really focused on really sending the message to the primary care physicians, to the employers, to all of those other folks who are bringing patients into these spine centers to understand exactly what is available. So Ali came to Mayfield, as I understand, a couple years ago. She has extensive background in healthcare, in sales, marketing, and is going to share a lot of her experience with us today. And Ali, I also understand that you're going to be graduating with your Master's in Health Administration in just 2 weeks, so congratulations on that too. Ali, if you want to go ahead and kind of get us started, I know we're going to do a little bit of back and forth as we go through this, but I invite you to talk a little bit about what it is that you do, and we'll kind of jump on it from there.
That sounds great. Thank you so much for having me today, and thank you all for joining us. I really appreciate it. I'm excited to speak with you all about my physician relations program that we have at Mayfield, and give you some best practices of what I do, and just really utilizing the opportunity to market directly to the referral sources to promote and grow your spine care program. So thank you so much for joining us. Just to start off by giving a very high-level background about Mayfield Clinic and the greater Cincinnati market for those of you who may not be as familiar. Mayfield Clinic is one of the largest independent neurosurgical practices in actually the world. For the last 75 years, we've built a long-lasting heritage based on the foundation of our commitment to both patient care, research and education, and technological innovation in the neurosurgical community. We have 34 physicians with all subspecialties, neurosurgical subspecialties, including pain management, spine care, and neurosurgery, obviously. And we have 13 locations throughout the greater Cincinnati area, and we serve more than 20,000 patients per year. So growing practice, and it's a very exciting environment. The greater Cincinnati market, just like the rest of the healthcare environment right now, is changing and experiencing significant shifts in the way that we practice medicine. There's currently 26 hospitals in the greater Cincinnati area, and we have almost 1,100 primary care physicians in the area, but that does not include pediatricians, just to reference that. We serve about 1.9, almost 2 million residents in the Cincinnati area through a 14-county tri-state area is what we call it, because we go through Ohio, Indiana, and northern Kentucky. And the biggest shift that we're facing right now, especially as an independent practice, is many of the primary care and specialty physicians are actually being acquired by different hospital systems. And we actually have 85% of our primary care doctors are now employed by local hospital systems, which is much higher than back in 2009, when only 43% were actually employed at that time. So this has kind of shifted the way that I have maneuvered my program and developed my strategies in terms of how I can market directly to the physicians and the practices in our area. So with that said, I will kick it off as to, what's the point of having a physician liaison program? What can this do for my spine care center in general? And I know that right now we see a lot of focus on transparency and the cost of care, and so many different websites out there giving patients the ability to, kind of analyze that quality of care. But even with all of these tools right at the, access of their fingertips, they are still depending on their actual physicians and their primary care physicians for referral sources. They still use that word-of-mouth referral as their source of how to determine the best plan of treatment for what their symptoms are. So 70% of patients use their primary source of care as their means for determining what specialists they're going to see, what procedures that they think is best for them, not so much using the internet and other resources that might be out there currently. So another reason is 75% of physicians actually still depend on their colleagues to obtain quality and educational information about new treatment options or the best quality care for their patients. So again, with so many resources out on the internet, even though that all of that is out there and it's very easily accessible for them, patients are still using their doctors for referral sources, and doctors are still using their colleagues and other professionals in the area as a means to send their patients to trusted places. So it's really important to make sure that your referral partners are getting the right information, useful information, and helpful information to help steer them in the direction of their patients in the right direction of what is going to be the best quality care for them. So the reality of the relationships with our referral sources are changing. Just in my program in the last 2 years, I have seen a big shift in the way that I have to approach, different referral sources and our primary care physicians and other specialties. And, where once a reputation or your clinical experience might have gotten you some referrals in the past and received patients in the past, it's really no longer the case anymore with what we're seeing. It's a lot more trust-based, and, they're getting incentives from different areas encouraging, in-network referral sources. A lot of these hospital systems are moving to more integrated care delivery models, and with that said, they're encouraged to keep their patients in network, to have that coordination of care throughout the whole continuum so that they can track the patient and make sure that the patient is getting the best treatment possible. And technology obviously impacts that as well, to make sure that they're tracking the patients appropriately. So this is kind of changing the way that we have to collaborate with the different hospital systems and different practices to make sure that we're meeting their needs and helping them to reach their goals in terms of their network of care. Other things that are kind of impacting the relationships that we're building or that we've established is the ability to adapt to their goals. So, one hospital systems might be, their goal might be to focus on the patient-centered medical home. So, keeping that source of care at home and keeping them in an outpatient basis. Whatever the case may be, we need to figure out what are we doing on our end to make sure that we're adapting to what their changing goals are. So that has been a big change and adjustment for us in our approach with marketing directly to referral sources. Again, with the spotlight on transparency and cost, obviously those kinds of things are all impacting just the morale of the entire environment and physicians, and they're having to do a lot more with a lot less. And so all of those things kind of impact the way that we have to interact and communicate with our referral sources. So so making sure that we're communicating the appropriate benefits and information to our referral sources is really going to be key in building and sustaining relationships. So if you think about how you make a purchasing decision, so you buy from people that you like and trust, obviously. Your referral sources also think the same way. They buy from people that they like, they trust, and that they know are competent, and they want to be confident in knowing that you're going to provide their patient with the greatest experience possible, and because that will ultimately reflect on them personally and their results. So building referrals goes a lot more beyond its transactional process anymore. It's really more building those relationships based on trust, and this involves give and take. So you have to figure out and understand what their goals are so that you can make sure that you're helping them to reach them, and consistently communicating how you can do that and how you can help them, I think, is really key. So, this is definitely a balancing act, and we're trying to meet and be effective and as efficient as possible with our delivery, but consistent communication and making sure that you are always giving relevant and good information about how you're helping them and their patient and providing a better experience for them is really going to ultimately be what helps to build that trust and that long-lasting relationship with your referral sources.
Ali, if I may ask, can we go back one slide to the
Sure.
slide?
Yeah.
If we were to look at this slide 10 years ago and look at what is it that referring physicians are most interested in, I would imagine a lot of these boxes would be exactly the same. Is there one area, certainly ease of access, communication, is the physician providing quality care with solid outcomes, or have always been important. Is there one that you feel is more important now with the rise of medical home and greater employment of primary care, where you feel you're spending more time now than you may have before?
Yeah, I think that communication is obviously a big part of it, because it's really all about, consumerism is becoming so popular in healthcare, and patients are really being more involved in their decision-making process and to, what their treatment should be. And physicians want them to be involved in that. And so I think that communicating how you're going to enhance that overall experience for their patient and making sure that they receive the best care is key. And so I would say that keeping that open line of communication is probably the most dynamic shift. It used to be I could go, and take them lunch, make sure everybody's happy, and kind of, make sure there aren't any fires to put out, and kind of just more issue management and resolving issues. Whereas now it's, I need to be in front of them consistently. They're busy. They have a lot on their mind. They're getting pressures from all different sources in their environment in terms of referrals, and so it's being on top of mind and being a trusted source that they know is advocating for the best interest of their patient. So, yeah.
Okay, thanks.
No problem. Obviously, there's going to be different goals for different types of organizational structures. So, whereas I represent an independent practice, a lot of you on the call today, I know, are involved with hospital systems or an outpatient surgery center. So, hospital systems might have, your goal for the physician liaison might be to build your network, to recruit physicians, to help them with the onboarding process, and to get them acclimated with your network of care, to build and retain those referrals. Or it might be to work with the independent physicians in the community and try and get them to focus on your network. So you might have a very different goal or a different mindset for, positioning your physician liaison program. Whereas outpatient surgery centers, they might want to focus more on talking about the benefits of what outpatient surgery centers really do, how they create an easy access point for their patients in a different environment than the traditional hospital setting, and building that relationship with the different hospitals or independent physicians, whatever the case may be. It might just be a varying goal that you guys have. And me as an independent physician liaison for an independent practice, my goal is to collaborate with all of the hospital systems and all of the independent community physicians here, and to establish a way to work with all of them to make sure that we're meeting the best care for all patients involved in the greater Cincinnati community. So, when you're thinking of your plan and thinking of how to approach your marketing to your referral sources, I think it's important to think about what is your ultimate goal for your program in the area and based on the market. So, with that said, my personal mission statement, so my goal of my program is to build loyal advocates and lasting referral patterns through managing and enhancing the customer experience. So I know it's very general, but at the end of the day, we get so caught up and so busy in our days trying to talk to everyone, follow up, and putting out fires, all of that stuff that keeps us busy. And it helps me to know that I am building advocates in my area to know that we are the best source of care for their patients and to enhance that experience for both them and their patients. And that's what keeps me driving every day, is to know that that's what my mission is, and that's ultimately what I'm here to do. So I think it's important to have a clearly defined mission or goal for your physician relations program, so that each organization, like I said, will be very different with what your goal kind of looks like. Some may focus on building lasting referrals through recruitment, retention, like I said, or focus on delivering higher quality care and relaying that message to all of your partners. Whatever the case may be, I think that just having a clearly defined goal will help your liaison to clearly understand what their mission is and what your expectations are for them. To meet that goal, these are just some examples of the objectives that I use in planning my strategies and my tactics for how I'm going to approach my market. But I need to understand the needs of my referring physicians. So like I said earlier, that's really changing in my market. So knowing what's important to them, where primary care doctors, they need more time. They need to know that their patients are being sent to the appropriate source of care, and that we're going to communicate those results with them and keep them very involved in their patients' care. So acting more as an extension of their organization and a partner in their patients' care. I need to understand, is that their goal? How can I help them? And really have a good understanding of that dynamic of how I can also, it's a give and take, like I said. So assessing performance against those needs. So, how are we doing now? What can we be doing better? What kind of internal quality improvements can we be working on to make the referral process easier for them, to make the patient experience better for them? Just really understanding kind of where you're at and where you need to be to help them reach their goals. And to assess community perception. So a big part of my job is what do people think of the Mayfield brand? What, do they understand the scope of services that we provide and how we can help the patient? So just kind of gauging the perception that people have of your brand, so that you can, again, understand, areas of improvement or possible educational opportunities. And then also, obviously, to develop and implement action plans. Once I have a good understanding of all of these things, that'll help me to be able to determine, what my messaging needs to be and who I need to be communicating that message to. Obviously, all of the things that I discussed earlier, the stagnant economy, health reform, and all of these new compliance requirements and changing requirements of health IT, the implementation of all the different patient records, that the government is requiring with the new Reform Act. We need to figure out how that impacts us and how that impacts our delivery with our referring base. So ultimately, patients are being more active in their health-related decisions, and those factors that impact their choices can include, several different things. It can include insurance plan approvals and how much that may cost the patient. It can, be the physician recommendations, who they're physician refers them to, or it may be what their experience preference is. So what's their goal? Do they want to get back to work as quickly as possible? Do they want, do they not have someone to help them at home with their recovery, so they need, a place that they can stay? What are the preferences of that patient and what their goals are in their treatment decisions? So applying how you can help them is what's really going to be beneficial here. So I think one of the biggest things that helps me in my job to be able to deliver on the promises that I make to our referral sources is having the internal team to back me up and to support me. It's one thing to go out and understand all of these things and all the challenges they have and all their goals, but if I'm just understanding it and hearing what they have to say and listening, but not applying anything to make internal changes and improvements so that we're meeting those goals and promises, then really at the end of the day, our job is irrelevant. So we need to be able to have the internal support and infrastructure to help us to be able to deliver on the promises that we're making to our referral sources. So, and this is at all levels, not just management, but my front lines, the people that interact with patients every day, are some of the most critical components to what I do, because they can tell me when there's any issues, so I can proactively approach those referral sources and make sure that we resolve everything and proactively help to manage that relationship. So it's definitely important to have the internal infrastructure that supports you in what your actions are and what your plan is. So,
Ali, when we were prepping for this, I was surprised to see human resources at first, and I know we talked about this, but can you discuss, marketing, operations, and certainly the doctors? I think that's sort of an obvious connection, but can you talk a little bit about how you and human resources interact?
Yeah, really, human resources, it's all about having the culture that's engaged in understanding what your company's mission is. And, our mission is to provide the best neurosurgical care possible to our patients. And HR is really where that stems from, and that creates that culture and environment. So everyone in my organization, thanks to my HR team, knows how important my job is in being able to deliver to our consumers and to our referral base. So, they kind of help drive the culture in the way that supports me, and so that everyone in the environment knows that, what we do at the end of the day is to help our patients and also their referring providers, so that we're, giving the best care possible. So it's really about engaging the culture and just instilling that environment so that everybody's on board and working towards the same goals and missions, and developing that support for me so that I can do that.
Appreciate that.
No problem. So another important element is to really map the experience of what it is your patient goes through in the referral process and in their decision-making process. So at Mayfield, this is a good demonstration of what our patients go through. Once they receive the referral, or if they decide to come receive spine care themselves, based on a word of mouth or experience, or got our name from the internet, whatever the case may be, we obtain that referral, and they go through the priority consult process. So we kind of triage our patients and make sure that we have all of the critical elements that's necessary to give them a diagnosis, and we do that virtually with our priority consult technology that we have. And that helps us to be able to give them a quicker response, and so they don't have to wait as long to get a consult with our surgeon. And so they're able to make that recommendation to the patient of what they think is the best treatment for them to help with their back care, to get them as quickly as possible feeling better and back on their feet. So if whatever procedure or surgery that the patient, that the surgeon recommends is talked through with our patients. And at that time, they make their choice of, based on several different factors of, what does their insurance cover, what are their goals, and so on. And so they make that decision, and then obviously, we communicate those results to the referring provider at that time. So thinking about the experience, though, you need to think about what are those impacting factors that kind of make the referral happen. So how does that referring doctor decide to send a patient to your center for back care? And it might be word of mouth or their experience with you in the past. The patient may request your organization. The insurance company might say that, might give the recommendation of your source of care. Or, the in-network, we've talked about that, in-network encouragement of sending to the specialists that are within your hospital system could also kind of impact those decisions. So understanding who might be a barrier or help you in your referral decision-making process is really key, so that you can go out and message and target those different potential factors that are kind of influencing the decision-making process. And that also goes with when a patient makes a decision for where they're going to have their procedure or their surgery. There's many factors, again, the payer recommendations or word of mouth based on, if a patient had a good experience at your facility or not in the past. Those things will impact their decision of where they're going to have their treatment take place from. So this can kind of help you to develop your framework for who you're going to target and the priority levels of, who you need to really focus on and what areas that you might be needing to improve relationships with, so that they can help you with your goal to increase patient volume. This is also valuable to help you develop, the value-based messages for each of the different segments, because all of them have different goals, in what they are doing as an organization or business. And so you need to understand what those different goals are and be able to message appropriately. So I'll kind of elaborate on the different segments that I focus on and kind of how I formulate my messaging to each one of them and some of the tactics that I use to do that. Obviously there's not one strategy or tactic that addresses all of the different targets. So you should determine, what's the best message for each and what is the most effective way to approach each of them. So, and this includes the referring physicians, who is really focused on the patient experience and having an efficient process so that it's less time for them to have to, spend in getting their patients set in the right direction. So increasing your exposure of, the expertise that you have, your outcomes, how your efficient process to help the patient get through quickly and get treatment quickly. Those are the kinds of things that referring physicians will be interested in hearing and understanding. So we do that through several different communication avenues, with visits and using professional web communities to communicate with them. And I'll kind of elaborate later on some of those deliverables and how I approach them. The payers and third-party resources really, what they're focused on mostly is the lowest cost possible and getting patients back to work as quickly as possible. So, things that we've done at Mayfield is have lunch and learns with some of the nurse navigators or care coordinators that work for these payer organizations, and communicating to them the benefits of, of outpatient surgery and outpatient procedures, and how that benefits patients in terms of cost as well as access and efficiency. And then case managers and other medical professionals really look at, they want to have the highest quality of care for their patients, and also affordable care as well. So again, educating them on the outpatient services, it's a little different approach than with the payers per se. But a lot of hospital systems and a lot of these primary care medical homes, they're having actual nurse navigators or care managers that kind of help the patient in their entire transition of care. So they're kind of helping to manage that process and take the patient through those steps. So just helping them to understand the benefits of what your organization can do for them is really going to be important to do.
Ali, on this previous slide, the amount of time that you're spending on each of these three, and I love that, there's focus beyond just the referring physician I know a lot of programs we've worked with, almost all of it gets focused on referring physician at first. But when you think about the time that you're spending on each of these, is it a third each, or some getting a little bit more? And then second part of that, are you seeing trends towards maybe in the future you think you're going to be spending more time on one category than you do now?
Good question. I would say that right now 75% of my time is spent with referring physicians. But I would say that as these different avenues of integrated care, so the ACOs and the primary care home models, I think as they start picking up in their popularity and they are starting to see the benefits of those, I think that we'll have to interact more with the payers as well as the case managers, because it'll be an integral part of their team, especially the case managers and nurse navigators with these primary care homes. They have to have an extension, a physician extender. They have to have a physical therapist. So there's a lot of more people involved in a team, and I think that the team-based approach I'm seeing that theme really be picked up throughout a lot of these primary care practices. So I'm even being directed a lot towards the referral coordinator, the case manager within the group practices, and they say that it might be based on the patient's preference of location. It might be based on it's really up to the patient, involving them in their decision. So it's not so much the physician directing the referral as much as it used to be. So I'll say that, yes, it's definitely rising in popularity, but right now 75% of my time is still focused on the referring physician. It's just being aware of the other players and being sensitive to their needs is definitely going to be important moving forward. So with that said, targeting your messaging to referring physicians is obviously very important. But your message will be a lot different, based on the type of specialty that, or the type of provider that you're targeting. So where primary care physicians are focused more on the patient experience, specialty providers might focus more on the quality of outcomes. They typically refer more complex cases because their patients already seek care from the specialized provider, and obviously it wasn't a successful measure, so they thought that a surgeon or the next type of provider might be more beneficial for the patient. So it might be a more complex level of care that they're considering. And primary care, like I said, it seems to be more team-based approach, and they're looking for more consultative approach to their patients. So they want partners to their team. They want someone to help them determine what the best next step would be for their patient and what those options look like. They want tools to help educate their patients on making informed decisions for their care plan. And like I said, they really consider the patient experience as kind of their indicator of value. Another increasing theme that I'm seeing is hospital-based providers, or hospitalists as a lot of people call them. So this is newer for us because primary care physicians and specialty physicians used to be the ones that would interact with their patients within the hospital setting and still kind of direct that source of care. But now a lot of systems are moving towards the hospitalist position. And so, that person would be focused more on the coordination of care and making sure that they're reducing, the opportunity for readmissions, because a lot of hospitals are being dinged for readmission rates now, and the cost of care, and taking all of that into consideration. So hospitals kind of help, make that more of a efficient transition of care and see that as their indicator of value. So now I'm going to talk about some of the tactical things that I use in my day-to-day to kind of approach all of these different types of providers and referral sources that I've been discussing. And at the end of the day, this is what I'm doing day in and day out to communicate the benefits of sending their patients to us, and how we can help them and how we can help their patients. database management is really important to me so that it helps me to be able to record all the key information that I am learning about all my different contacts that I interact with in a day, so I can help to build that relationship with them in the future. I actually send out a survey when a new physician comes into town, or if I'm introducing myself for the first time, and asking that physician, what's the best time to reach you? How do you prefer to be reached? Just so that I'm making sure that I'm not a nuisance in their day, that I'm a beneficial part of their day, and I'm reaching them at a good time that they're able to communicate in their preference of communicating. So I actually get an 80% return rate on those, which is great. So it helps me to be able to build that relationship and to consider their day and their needs. So targeted communications is self-explanatory. I mean, this is how we use different mechanisms like email and direct mail campaigns or post, whatever the case may be, to announce, new information about what we're doing, any changes we've made, anything that could possibly impact or help their patients. Community outreach is becoming a big part of what I'm doing. I'm actively involved in many organizations here in town that's related to the healthcare community, to build that community awareness and to show that we are involved with all the different hospital systems in the area. I do a lot of health fairs. I attend a lot of health fairs and a lot of different trade show events that they have. So that's become a big part of what my job is. I also work with our physicians on getting them exposure through different education opportunities and grand rounds opportunities. Working with the different hospital systems here in town that offer grand rounds to their physicians is great exposure for that physician to build that trust with with a group of 150 physicians sometimes. Sorry. So that's been another big focus for us, to getting more exposure with one interaction. So strategic partner education also, I mentioned earlier, doing lunch and learns with different case managers. I do that pretty often on a monthly basis, actually, with a lot of the different hospital systems here. I'll go in and meet with their case managers as a team and understand kind of what their challenges are, so that we can make sure that we're adjusting things internally to meet what those challenges are and help them in their jobs and to be more successful. Satisfaction surveys, we send out a monthly satisfaction survey to our patients that have come, and we do every other year we'll do a physician's satisfaction survey as well. And then, like I said, the communication survey is another thing that I do on my own to just find out, key information about our referral sources. And then marketing materials, obviously, it really helps to have the support to allow me to be able to go out and to educate our community on what it is that we do and the different treatments that we have. So having a team to support me in developing these items is really what allows me to go out and to promote our message. So we do a lot of patient education materials, and actually that's probably one of the biggest calls that I get is for more education materials. And it's, we have a brochure that focuses on preventative back pain, a guide to help them with different exercises and things that they can do to prevent back pain in the future. And I get continuous calls for that, so that the referring physicians can hand those out to their patients and help them with their wellness measures. So, and then personalized communications. I'm very big on handwritten notes. I think that's a lost art, and if there's news about a new physician, or if someone has had a job transfer, or just thanking them for their time, for sitting down and meeting with me, I always am sure to send a personalized handwritten note for myself, and I just think that enhances the trust and the likability. And then, of course, all of this leads up to practice visits, which is one of the main keys as to what we do as physician liaisons. So, understanding that providers and their staff are limited on time, and so, I always try to have a pre-call plan done so that I can understand, what is my objective of going on this call, and what am I trying to accomplish, before I go. I try to schedule most of my visits for the most part, but I know that that's not always possible. So I definitely will do drop-in visits if I have some relevant information that would be beneficial for them, or just to interact with their team as well. I just try to maximize my time out on the road to make sure that I'm doing as much as possible to get as much face time as possible. And another part of what I do is plan visits to take my surgeons out and my physicians out to meet with other referral sources. So if I think it'd be beneficial for them to meet with some new doctors that came into town, or someone who had a problem or complaint, I'll take an afternoon where I schedule visits with my doctors and take them out, and I think that that's always very beneficial and helpful for both parties to be able to establish the relationships between them. I'm just a middleman. I'm not the one that's actually behind the hands doing the patient care and treatment and surgery. So at the end of the day, that's really who they are trusting in all of this is that surgeon with their patient's care. So the more exposure that they can have in meeting them and getting to know them is obviously the better. Like I mentioned, I always do a pre-call plan just to make sure that I'm not wasting anybody's time, and that I always have my objectives and know what I'm going in there to discuss and to talk about, and to maximize any face time that I get with anyone within the group. So kind of how I plan my visits and my week is I have created a dashboard which filters referral information from our Priority Consult software, as well as our management software to determine, kind of flags me as to what areas of town are decreasing. What's the trends behind what's going on with the referral numbers? Is there someone who's decreased significantly within the last couple of weeks? Is there someone who's increased significantly or sent us a brand new referral? So this dashboard that I've created kind of helps me to look at the geography of my referrals, and also kind of flags me on some trigger events that I need to that are alarming and that I need to address. So this is really what I use to help me kind of plan my strategy, my ever-changing strategy. And the way that I measure my results then, and to make sure that I'm successful in everything that I do, is I kind of look at several different areas. I look at, how many issues have I resolved, and these are just example numbers that I threw in here, but, I'm a goal-oriented person, and so I need to know that what I'm doing is effective and successful. And so if it's not, and I'm not reaching my goals for some reason, what's the problem? What can I do differently to make sure that I am reaching it? So I look at my level of activity, I look at my level of incoming calls, I look at my level of, obviously, referral volumes for the different service lines, and new referrers, and also overall satisfaction from patients and our referring providers. That's also a big indicator of if we're doing our job well. Another way that I measure my success is I sit down with my physicians on an annual basis, and we go through a referral report card. And this just kind of gives them a historical snapshot and an indicator of where they're at, and what the trends are, if we're moving in the right direction or if we're moving in the wrong direction, and understanding what their individual needs and goals are, so that we can pinpoint maybe some specific targets. We'll actually even narrow it down there by different physicians, referring physicians on an individual level, so that we can, again, kind of have an obvious trigger if their referrals are increasing or decreasing, so that we can focus our priorities and make sure that we are meeting the needs of my internal stakeholders, which is important. So that's really all I have prepared today. So I am happy to if anyone saw anything that's really appealing to them and has further questions, or if I can provide them with samples of anything that I've done that would help them in what they're doing, I'm happy to do so. This is my contact information, and I'm happy to help in any way. If I've given you hopefully some good ideas and best practices of how you can maybe take some of these ideas and apply them to your organization and to enhance your physician relations and engagement program. So, thank you.
Ali,
Yes.
that was excellent, and it's wonderful to see the level of organization that you're bringing to the role. I was wondering, as we allow folks, if they want, to type in some questions in the panel at the bottom of their GoToMeeting panel on the right. Can you talk a little bit about some of the restrictions that you're experiencing based on gift giving, and you can't just go in and buy a huge lunch for the docs and so on as much anymore? Or at least that's the sense I'm getting.
Yes, that is correct. There are restrictions, we all know the Stark laws, that do kind of inhibit the amount of gifts that physicians can receive on an annual level. So, a lot of practices actually won't accept lunches. It depends on maybe what their employers, require, or what their protocols is. So, so in terms of like Christmas gifts and things like that, like, I think about it on a bigger scale so that I can, I provide things for the whole office versus just a, physician basis. So you just have to be cognizant of knowing that they are limited in what they can receive now based on all of these new changes. And so just having that in mind can also help you just to kind of plan your strategy and, tactics around what kind of gifts to give out.
Excellent. The question we always get is, can we have access to these slides? So one way I'm going to share this with everyone, and we're going to make sure we're going to have this online probably by the end of the day. But if there are those of you who feel there's someone else from your organization that would benefit from this particular presentation, don't worry, we will have this available through the Priority Consult website. They can re-register and watch this at a later time as well. So, Ali, I really appreciate your time today. Thank you so much for joining us. This was wonderful information, and we look forward to hearing. Go ahead. Yeah.
No, I was just saying thank you. I appreciate you letting me speak to everyone today, and thank you for everyone joining. I really appreciate it, and I look forward to hopefully maybe talking to any of you further if we can bounce ideas off of each other.
Excellent. Well, we'll help put that together. And for all of you who are interested, once again, in the workshop that we're putting together, we're going to have 5 great presentations like this on July 26th. Hopefully some of you guys can join us out there for a full day of activity related to sharing best practices. Until then, and until the next webinar, we wish you all good luck, and thank you very much for your time today.